We'll be talking about lumbar stenosis. Before that, let's a little bit go about this spinal cord. You have this spinal that is into three parts. So from here to here, there are 7 vertebrae, spinal vertebrae. These are called cervic vertebra. And then from the neck to the middle of the body, that is the kind of the end of the rib cage, there are 12 vertebrae. These are called thoracic vertebra. And then downward from the end of the rib cage up to the buttock, there are 5 vertebra. So these are called lumbar vertebra, lumbar spinal vertebra, kind of special bones. And here inside there is a hollow pipe, there is a canal. This is a spinal canal. So what happens if it is here little bit squeezed, that is stenosis, that is cervic stenosis. If it is up to here, you have thoracic stenosis. But when you have problem there downward, that is the lumbar stenosis, the narrowness, the strictness, a little bit narrower of the canal. This is lumbar stenosis. So we'll be talking about lumbar stenosis. When you have this problem, there are a lot of problems, back pain, and the pain from the waist will go down towards the legs. Very severe pain, mild pain. These are really uncomfortable. So there are symptoms if you have lumbar stenosis. And you have also burning pains, and you have loss of sensation. This is also very important. Loss of sensation. You won't have the sensation as you should have in the legs. So you don't have the sensation, you lose the sensation inside your legs. And there will be foot drop. This another problem, foot drop. When you have polio, what happens? You cannot walk properly. While walking, you will have drop legs. And the other problem that is very severe, this is loss of sexual intercourse. You may not have the power to have sexually aroused. There will be a sexual problem, kind of erectile dysfunction. You will not have the power of sexual ability, the loss of sexual ability. This is another problem because of lumbar stenosis. So you'll have numbness in your legs, in your buttock. You won't have that power to hold your body up. So if you have overweight, that's really a problem. You won't have overweight. And what the number one thing what you should do is that you will sleep for 8 hours every day, and you will stay lying in the bed for 9 hours. What happens? You may not be able to sleep all these 8 hours in course of your age. What happens in course of time? We always lose the time period of sleep. So the thing is that you try your best to sleep 8 hours as good as possible, and you will be lying in the bed for 9 hours. This is very important. So to my understanding, the number one remedy that you must do is you will stay in your bed for 9 hours, and you'll try your best to sleep for 8 hours every day, 365 days, 720, I'm saying 7 days. And so let's go more about it. So cervic vertebra, 7 vertebra, and here thoracic vertebra, spinal vertebra, that is 12, and then downward, that is lumbar spinal vertebra, there are 5 vertebra, and you have inside there is a pipe, there is a canal, that is called spinal canal. And this canal, if it is squeezed, if it is little bit narrower, it gets narrower. So the problem is with the blood circulation, all these vitamin, minerals, oxygen, all these go back and forth via your veins, capillaries, veins, arteries. So these are very important. So you cannot have the same amount of supply of those oxygen, vitamins, minerals, all this. And so there'll be a shortage, there'll be a problem. And when you pull something very heavy, that may get squeezed and it pressurizes your spinal cord, it pressurizes your canal, and that's how the pain starts. And this pain from the waist, it goes all the down towards your legs, and it's very uncomfortable. Why does this lumbar stenosis happens? Mainly because if you have osteoarthritis, this is a serious problem. It's usually this is more common in women than in men, and after 55 years usually people start having these lumbar, osteoarthritis. And this lumbar stenosis usually it starts happening among those who are 50 years old or more than 50 years old. There may be some other people who have started having this trouble at their early age, because there may be an injury to the spine. Because of this injury of the spine, lumbar stenosis may occur when you have a spinal tumor or tumors in your spinal cord. Then you may develop this lumbar stenosis, the narrowing of the spinal canal. And you may also have certain bone diseases. Because of those certain bone diseases, you may also get affected by lumbar stenosis. Stenosis means getting narrower, right? You may also have post surgery. You have had already spinal surgery, the surgery of the spinal cord, the spine. So when you have had already the surgery of the spine, it may help you get this disease. It's very dangerous. So post surgery of the spine. And another reason is that rheumatoid arthritis is another cause for the lumbar stenosis. A herniated disc can also be a reason for having this. So osteoarthritis is very important. You may have it because of some problems. At the same time, you can have this problem because of autoimmune disease. So like the diabetes type 1, what happens in diabetic type 1, the body misunderstands and attacks beta cells that are inside pancreas. So you have pancreas, and there you have beta cells in pancreas, and these cells are damaged. That's how the type 1 diabetes occurs. And so osteoarthritis is similar to that. The osteoarthritis may affect you because may occur because of this autoimmune disease. And right, so these are the problems that you may have, and because of these you may develop lumbar stenosis. So what I tell is that the number one thing that I think is that as we are supposed to sleep for 8 hours and we're supposed to stay in bed for 9 hours, so all 15 other hours you can little bit move. You don't pick up the heavy weights. Don't do it, it's dangerous. Do not run fast. You have to understand how much you can go about. All right, movement is necessary, exercise is necessary, but you have to understand how much. So when you are having exercise, you may have the pain. After you have finished the exercise, you may also have the pain. And when you have been sleeping and you are now trying to leave the bed, you may also get the pain because the lumbar gets rigid, stiff, little bit hard, not flexible. Then there may pain may start. So these are the things you have to avoid, and the most important thing is that you have to have little bit tension, not much more than that. Your tension must be under control, and You have to have good exercise depending on the situation, overall situation in your health, and you have to sleep 8 hours or so. At least you have to stay in the bed for 9 hours and every day. And then you have to have good food without sugar, without carbohydrate, without starch, vegetables, all these good foods that are really good for the health. A lot of fat, no carbohydrate, no rice, no bread, no sugar, no milk, sugar in your tea, green tea, coffee, like that. And the other thing that is very important is you have a lot of, for a long period of time, intermittent fasting. You may have dry fasting in the month of Ramadan, and any other time you can have dry fasting, but for medical ground you can have no food for at least 15 hours. No one should eat. Everybody must have a break of eating for 12 hours, but in this case you try your best to have no food in 15 hours, 16 hours, 20 hours, 24 hours. So if you have a cancer, what happens? The people who are suffering from cancer should have no food for 2 days, 48 hours. 48 hours without food. You can drink water, you can have tea, green tea, coffee, but you don't have to have anyway sugar and milk. This is how, if you try your best. So let's go for the summary. This is cervix, right? Cervix vertebra in this is a spinal, and then the thoracic vertebra 12, and then lumbar vertebra, and there you have the canal, and this canal gets narrower and stiffer, and nerves get stiffer, and all these problems get on you, and you'll have back pain, you'll have burning pains, and they will go from buttocks to legs. You have loss of sensation in your feet, very bad, and you have foot drop. You cannot pull up the leg properly, like a little bit like paralyzed people because of polio. And you have probably loss of sexual ability. So this is very vital. Sexual ability may not be, there'll be a problem with, right, this. So loss of sexual ability is another problem. That's it for now. Thanks for watching.